Imagine waking up every day feeling sluggish, irritable, and struggling with stubborn weight gain despite your best efforts to get rid of it. What if I told you that the culprit might not be low testosterone, but an unexpectedly high estrogen levels? High estrogen levels can mimic or be just as problematic as low testosterone symptoms, things like fatigue, mood swing, and of course, weight gain. My name is Dr. Terrinella, and in this video, we're going to uncover the factors that elevate estrogen levels in men from different genetics to lifestyle choices, and what you can do to take control of this problem if you have this going on. So if you're getting a lot out of these videos and want to continue getting videos like this, hit the like and subscribe button, and let's jump into the video. There are definitely a lot of things to consider when looking at high estrogen levels in males, and sometimes it's just a relative increase in estrogen compared to how much testosterone is there. But we want to look at three main topics with regard to causes of high estrogen in males. So we want to look at things that increase estrogen production, including genetic factors. Number two are things that increase or alter estrogen clearance, including genetic alterations and genetic factors. And lastly, we want to look at lifestyle factors or things you can do to enhance the estrogen clearance or decrease the estrogen production. So let's start with how the body actually produces estrogen in men and a detailed look at what's going on here. So the first thing to note about estrogen production in males is there's actually three different types of estrogen. The most biologically active is estradiol, and this is the one that's typically measured in the blood, and that's because it's the most biologically active and the most important. The others are estrone and estriol, and our bodies convert testosterone and other androgen-like substances into these estrogens through an enzyme called the aromatase enzyme. It also goes by another name, which is a CYP name called CYP19A1. And this aromatase process or enzyme activity is normal. Certain situations can increase or decrease that aromatase enzyme activity. So let's look firstly at the increased enzyme activity or increased aromatase enzyme activity. So there are some lifestyle factors or inherent vulnerabilities in certain individuals that are going to increase this aromatase activity. One major driver or influencer of the aromatase enzyme is obesity, and in particular when there's insulin resistance. More adipose or fat tissue means there's more aromatase enzyme activity, leading to more conversion of your testosterone into estrogen. Also, the androstenedione is another androgen that also will get converted into a different kind of estrogen as well. And this is why it's often associated that men that are overweight or those that have higher blood sugar like diabetes or insulin resistance tend to have higher estradiol levels. This is definitely something that I've seen in my practice as well, but doesn't always happen. There are other things going on here. It's not like a one-to-one relationship. There's also some men that tend to have higher levels of estrogen as they age, and that's because the aromatase enzyme naturally increases as you age. And this could be due to the fact that muscle mass is decreasing and the fat mass is increasing, leading back to the aromatase activity. But inflammation also plays a role. Mainly the cytokines IL-6 and TNF-alpha can increase the aromatase activity, and oxidative stress, which also increases with aging, also increases the aromatase enzyme activity. So looking at this as a whole, as we're aging, we have increased fat mass, decreased muscle mass, and you also have a declining testosterone levels as we age too. And so that's all going to lead to a relatively higher estrogen level. And you also layer on top of that increased inflammation, which is common with aging, and you're potentially also going to get more aromatase enzyme activity, more estrogen production as well. So aging in general creates a recipe for a much higher estrogen level, but it's not necessarily going to happen to you because these factors are manageable, and we're going to talk about that later as well. So as we alluded to with the aging part, inflammation can increase the aromatase activity as well, but this can also happen with chronic illness and increased oxidative stress and inflammation. And there's different chemical names involved here with the inflammatory cascade. And one of them you may have heard of called NF-kappa B is an inflammatory chemical that binds to the promoter region of the aromatase enzyme and makes that enzyme more expressed. It's going to increase the activity of that enzyme. And this pathway is crucial in the inflammatory response. And so it's often going to be found high levels of NF-kappa B in people with chronic health issues. Whether you have metabolic syndrome or rheumatoid arthritis, it's more common for you to have higher estrogen, higher estradiol levels. Most illnesses that people have are defined by the itis on the end of their names, things like prostatitis, sinusitis, cystitis. A lot of these things are signified by the inflammatory process going on in the body. So if you have chronic health issues going on, chances are you do have inflammation in your body, even if it can't be detected by the typical means. And so if you have higher estrogen levels and you do have chronic health issues going on outside of the estrogen, chances are there's an inflammatory component going on. But it could be that it's just simply more of a genetic factor. So genetics also play a role in increased estrogen production, and there are specific variants in the CYP19A1 gene, which is the gene that encodes for the aromatase enzyme. And it can result in either an increased production of estrogen or increased activity of the aromatase enzyme or decreased activity of it. For instance, the SNP with the RSID 6493497 and 7176005 have been associated with increased aromatase activity and higher plasma estradiol levels in breast cancer patients undergoing aromatase inhibitor therapy. The RSID variant 700519 is linked with increased conversion of androstenedione to estrogen and increased aromatase activity in vitro. So those are some of the things that can lead to increased estrogen production. But what about the breakdown or elimination of estrogen? Might these be playing a role as well in your high estrogen levels? And certainly they can. And so that's what we want to look at, is the other side of the coin here. So the two main areas that we want to look at is methylation and glucuronidation. These are two key phase 2 detoxification pathways that allow our bodies to get rid of estrogen as well as other compounds. One of those methylation pathways is called the COMT, or catechol-methyltransferase enzyme. So this enzyme deploys methyl factors and methyl donors in order to bind to the estrogen to allow it to get out of the body. And there are genetic polymorphisms in the COMT gene slowing down the activity, which then leads to higher abundance of estrogen levels. And it's the MET variation in the COMT gene that leads to this problem. But you certainly can use the cofactors for this enzyme, like magnesium, like SAMe, to help enhance the activity of that enzyme. Sometimes people just don't consume enough of the methyl donors, like methionine-rich foods, and that will also slow down the ability of that COMT enzyme to work. Environmental toxins such as heavy metals like mercury, lead, have also been shown to reduce the COMT enzyme activity. You should note too that this enzyme also clears stress chemicals, so people with more chronic stress may deplete their SAMe and deplete other cofactors that are needed for the COMT functioning. The glucuronidation pathway also has genetic variants in it as well, and one of them is known as the UGT1A1. And when you have variations in this one, the activity of that enzyme can be slowed down and reduce the excretion of estrogen. The RSIDs 887829 and 6742078 are associated with decreased glucuronidation. Problems in the liver like hepatitis or fatty liver can also reduce glucuronidation. And vitamin deficiencies in magnesium and B6 can also impair or reduce the activity of the glucuronidase enzymes. All right, so now that we talked about how your body increases estrogen and how it can be impaired at eliminating it, let's discuss some specific things you can do to lower your estrogen levels when they're high. We already kind of alluded to some of this, but in the case that we think you might have increased estrogen production, step one in optimizing or lowering your estrogen levels is to decrease the production by reducing your insulin levels. As we said, insulin resistance and diabetes increases that aromatase enzyme activity, and diabetes also can promote inflammation, which also can promote the aromatase enzyme as well. And insulin resistance thrives on high carbohydrate diets. So reducing your carbohydrates and overall adipose tissue can help with reducing estrogen production if this is the problem for you. The key here is checking your labs to kind of get an idea of what's going on. And you can do that by checking the various insulin resistance markers, which I've discussed in other videos. If you have more or think you might have more chronic inflammation or autoimmune disease, that's probably also promoting the aromatase enzyme activity. And you can reduce your inflammation or downregulate the NF-kappa B pathway by taking things like turmeric or curcumin. And it's also common if you have some autoimmune condition that you're already taking medicines that are going to downregulate some of these pathways. All right, so now on to increasing estrogen clearance. So to enhance estrogen clearance, you can add things like calcium D-glucarate to improve your glucuronidation. If stress or methylation issues seem to be more of the problem going on with you, you can also add things like SAMe and magnesium to help that COMT enzyme clear your estrogen levels. I think it's important first when you have high estrogen to understand where that might be coming from, whether it's genetics or the inflammation or insulin resistance or problems with clearance. I generally don't recommend a scattered approach to lowering estrogen, taking 5 different things or 5 different approaches to lowering it. In some cases that may be necessary, but best to try and narrow it down to like what is the most likely cause for my high estrogen. Sometimes people have more than one thing going on, but the idea is to narrow in on one, recheck the levels, see what kind of impact that's made. So hopefully this video helps you better understand the causes of high estrogen in males. If you have questions about anything noted here, please drop it in the comment section. I'm happy to answer your questions. That's why I do the videos, to help you better understand what's going on. And if you want a more nuanced answer, consider joining the membership program. We'll have more time and attention to dedicate to your questions. And until next time, might I interest you in another video on testing for estrogen right here.